It feels so good to be back. Guys, I did it with the help of God, with the encouragement of people who love me, and with the encouragement of people who also follow my content. I always got messages of encouragement because when you go for a terminal degree, you are going to work and you need to have people around you who want the best for you. You need that. I got something in the mail today, or rather I didn't get it today. I got it a few days ago and I put it in my office and I was gonna open it. And I was gonna open it on camera, and then I thought, no, I'm gonna wait until the day of my graduation. So I got this in the mail. It's from my school, and I know that it's my degree. And I thought, because my graduation is going to be virtual, that I want something exciting to happen that day. I mean, it's exciting that I'm going to be graduating and we have to like record something in advance. And I thought, but I still want something special to happen that day. So I did not open this. I'm going to open it on October 17th, the day of my graduation. So I think that gives me something to look forward to, because normally you would be looking forward to walking across the stage and all of that. So I've kind of built up anticipation for something on my own. So I'm really excited about that. I can't wait to see it. So I will do that on camera. That's going to be fun. Some of the questions I've received have been like, why did you go for a doctorate? Was the program difficult? So I will answer a couple of those questions today. Well, I was confused. I wasn't sure if I wanted to get a DNP or if I wanted to get a PhD. So I did research on both degrees. In a nutshell, the DNP degree is practice focused. And with this degree, we are focusing on the translation of research and improving patient outcomes. It's practice focused. It's a clinical doctorate. You're focused on the translation of research and improving patient outcomes, along with some of the other things such as health policy. You're also considered an expert in the clinical field, while the PhD degree is research focused. The goal is the development of research. So I had to ask myself whether I wanted a clinical focused terminal degree or a research focused degree. And I love taking care of patients and I love the clinical setting. So I knew the degree for me was the DNP, because I would be using the education that I received to improve patient outcomes, to translate research. So the first step was deciding what degree I wanted to go for and then what school I wanted to go to. You do have to do a project. So I did my project on diabetic foot self-care. And it's funny that, I guess it's not funny, but I kind of knew that I would do something in the way of diabetes because a lot of my patients have diabetes. And when you think about doing a project, you want to think about doing a project that would benefit the patients you serve. So initially I was really confused about what I wanted to do as far as a project. I knew I wanted it to be about diabetes because I like diabetes and many of my patients have diabetes, but I just wasn't sure. I still wasn't sure what the project would be about. So I just really put a lot of thought into how I could help my patients. And I came up with the diabetic foot self-care issue that I had noticed, and I thought it would be cool to really focus on improving patient outcomes as far as, prevention of diabetic foot ulcers. So I really thought about the benefits of educating patients on diabetic foot self-care and increasing the frequency of them doing this foot self-care, and how that would decrease the incidence of foot ulcers and how it would decrease the incidence of non-traumatic amputation of the lower extremities. So that's what my project was focused on. If you want to be successful in treating a patient for diabetes, you have to provide adequate education. So I kind of took that and applied it to, a foot self-care program in the clinic that I work in, and it was very successful. So yeah, that's what my project is about. And even now, like after doing that project, I really focus on educating my patients on diabetic foot self-care, because you can save someone's feet that way by providing education. Just being a medical provider or a medical professional, we know how important education is, because a patient is with you for a few minutes, 15 minutes or so, and the rest of the time they are home. So they need to know how to care for themselves. I'm very big on education. So I picked a project that I was passionate about and that I really believed in. The whole 2 years that I was in this program, or a little over 2 years, it was pretty much, when you're working on the project, you do get to the point where it's writing the same thing over and over and over and over again. So you have to love this. Whatever it is you choose to do, you have to be in love with that project and believe in that project. And just knowing that you are going to help people, you are going to save lives or limbs or whatever, that gives you the motivation to keep going, because you're doing something for other people. So I did choose a passion project, a project that I was passionate about and that I wanted to see this come to fruition. So that motivated me to keep going, to do the research needed, to be able to implement this project. And again, when you choose a doctorate in nursing, a DNP degree, you're focused on the translation of research. So I had to look at all of these research studies on diabetic foot self-care, and I had to create something where I could translate this research into my clinic and the patients that I serve. So it was really interesting, and it really builds your confidence in your ability to translate research, because that's what you are going to do. So you really end up being very confident after you have taken all of this research and you've put it into a project and you've implemented the project and you've done the statistics. Your mind will be stretched when you do this. So if you do decide to go for a doctorate degree, I think the first step is knowing what you're going to do for your project. When I entered this doctorate program, I was not sure what I was going to do for my project. I just knew it was diabetes, but for some odd reason, I thought, the first semester or the first class, I'll really hone in on it. I'll really come up with it. In most of these doctorate programs, you hit the ground running. You need to know what your project is going to be about, because no one's going to help you decide. these instructors are really, hoping, and they do help you to develop your idea, but you need to have an idea. So if I could do things over, I would go into the program 100% sure about what my project would be about. You also want to make sure that there is enough research done on your project. You do not want to choose a project and there's really no research on it, because how can you translate research on a project that, there aren't many research studies? I needed at least 50 research articles in my literature review. So that kind of tells you everything as far as, is there enough information out there for your project? If you decide that you're going to school for a doctorate, what's the first thing you need to do? You need to know what your capstone project is going to be about. I ordered a few books and read a little bit about other people's capstone projects, and that helped. I did an internet search about capstone projects, and that helped as well. So doing your research and going back to the basic, which is, what do my patients need? How can I help them? That question led me to what my capstone project would be about. Over the last 2 years, there was a lot of writing and rewriting and refining my project. There was frustration because you think that you got it in the bag and you get your manuscript back and you're like, I don't have it in the bag. This is a mess. So being patient with yourself, believing in yourself, having, if possible, have a chair that believes in you. I want to take a moment to say that my chair, I have never met her, but she believed in me. And that meant so much, because when you're down and when you feel like I can't do this, your chair will push you over that hump, push you over that obstacle. Like, no, you have to keep going. So at one point, this was at the very end of the program, I was so over everything, and I felt like this is too much. I need a break. So I decided that I was going to just, chill out and take an extension course. I was just like, I can't. And my chair was just like, no, turn your work in. And I go, okay. It's like, I just needed that. I needed people in my corner who believed in me, and she believed in me. And it was a wonderful experience because I had that type of support. You guys will be seeing a lot more of me. Thank you for sticking in there with me. Oh, let me tell you guys. So the day that I graduate and I open this, I am going to do it online. And I also will upload a video about my whole experience, because during the 2 years, I kind of kept a little video diary. I wasn't so good about it towards the end, but during times of frustration, I did capture some of it. During times when I was really happy because I did well, I captured some of it. So I will share that with you guys in the form of a video after my graduation. And my graduation is October 17th. So I will definitely upload it at the end of October. So that's going to be nice and interesting because it'll kind of show everything I went through for the most part. Yeah, lots of tears. I have gotten a lot of questions as far as, is it difficult? am I able to do it and work full time? So the program that I went to, I had a class every 8 weeks. It was at the very beginning when you were developing chapter 1 and when you were doing some of the, classes. All of that was doable. I mean, the whole program obviously is doable because I'm done, but all of that was doable. And I thought, wow, this is a piece of cake. I'm answering a couple of discussion questions and responding to my peers and, doing a little research, making sure that my responses are professional and scholarly. But then as I progressed through the program, things did get more difficult. They did get more rigorous, and there was more research required because, as I mentioned before, chapter 2 of my manuscript was a literature review, and I needed 50 articles, and that chapter alone was about 25 pages. So as you progress in the program, I think it does get more difficult, but still doable. I did get to the point where sometimes I wouldn't post anything for weeks because I was too busy. And yes, I feel like my life was on hold for like 2 years. But we have to sacrifice, something. So when you want something in life, you have to make sacrifices. And I was willing to sacrifice, my time and my ability to do other things for this. And I'm happy I did because it's something that I wanted. If you guys follow me on social media, especially my stories on Instagram, I usually stayed up until 3 or 4 o'clock in the morning, and then I would go to work. I would sleep for an hour or two, and then I would go to work. I'd have to be at work by 7, and that was like my life. A lot of nights I'd stay up until 2, 3, 4 o'clock in the morning, sleep for 1 or 2 hours, wake up for work. And that's just because I wanted this. And that's what I had to do to get everything done. Other people may have a different schedule or be able to fix things where they don't have to stay up that late. But I did. Sometimes I would go into my office at 8 o'clock in the morning and I would stay there until midnight, or 1 o'clock in the morning or so. I just had to finish what needed to be finished. And sometimes it would be an all-day affair. And I just kept in mind that this was not something that I would be doing for the rest of my life. So I knew that everything I was going through was temporary, and I was just willing to suffer through it, feeling tired and beat down because I wasn't getting enough rest, just temporarily, so that I could finish this, because this degree was something that I could not stop thinking about. I could see myself in this role. I just felt like it was something I needed to do. And also, it was something that I wanted to prove to myself. And it was also something that I wanted to do for people who follow me for encouragement, just to show them that you can be whatever you want to be. If you want it enough, you can get it. You just have to want it bad enough. And I wanted this so bad that I was willing to sacrifice sleep. I was willing to sacrifice time because I wanted this. And I understood that sacrificing all of this stuff for now didn't mean that it would go away. It just meant that I can't do any of that stuff right now because I'm focusing on this. I need to get this degree, and then all of that stuff will still be there. So for those of you who are just like, well, I don't want to miss my barbecues, and I don't want to miss my parties, and I don't want to miss this, and I'm missing out. It'll all still be there when you finish. And the time is going to pass anyway. We've talked about that before in the past. So when people say, oh, a doctorate is going to take 2.5 years. Oh, a PhD, it's going to take this long. Well, that time is going to pass anyway. So you can spend some of that time studying and obtaining the degree. And then when the time passes, you have the degree, versus when the time passes, you had your fun and you don't have the degree. So the choice is yours. Leave questions and comments below. Leave video suggestions below because now I can address them. And also to all of the people who send me emails, who send me DMs on IG, and who send me messages on Facebook. Guys, I love you. And I am going to start answering questions and answering those messages because I have a whole lot more time now. Until the next time, be well. I dive into